Assalamualaikum warahmatullahi wabarakatuh. Good morning, friends. On this occasion, we will present the result of our group discussion regarding the topic of assessment to diarrhea patient. We are from group 5, consisting of Hervey and Okta as the case reader. The second is Devin Siska as a dialogue reader, and the third is myself, Nor Afifa, as a patient assessment data. Please listen to the presentation of our group.
On October 50, 2020 at 8 a.m., came a 30-year-old patient named Mrs. H, female gender, marital status, high school education, private work, Islam, addressing Karabanda with medical diagnosis of diarrhea. Mrs. H came to the hospital with her husband named Mr. D. Islam, private work, Karangbondo address, relationship with the patient as husband. The patient come to the hospital Dr. Haryoto with the main complaints of abdominal pain, limb, nausea and vomiting, fever, headache, feeling thirsty, and diarrhea with the defecation frequency 6 times signs overnight with liquid consistency yellow and blender. According to the patient husband before diarrhea, Mrs. H boxed food on the side of the slum. After my wife had consumed the food that had been boxed, my wife felt a stomach ache and often went back and forth to the bedroom. Because my wife went back and forth to the bedroom later in the morning, my wife looked at limb, and before being taken to the hospital, Dr. Haryato had taken Enterosop but did not recover, so I took my wife to Dr. Haryato Hospital. History of this case in the past, patient said they had typhus in the December 2018 and were related at Dr. Sabandi for 4 days. Family disease history. Patient say in the family no one suffers from infection disease such as tuberculosis, hepatitis, and declining disease such as hypertension. Exactly. At the physical examination obtained cosmetic awareness, general state of lyme, nausea and vomiting, fever, headache, and diarrhea. For vital sign examination obtained pulse 80 x min, blood pressure 120 80 mmHg, temperature 30 x Celsius, respiration 21 x minute.
Good morning, doctor.
Morning, ma'am. Please come in.
Yes, doctor. Thank you.
Introduce, I am Dr. Drake Jacob, commonly called Dr. Drake.
Mrs. H, doctor.
Mrs. H from where?
I'm from Karangbenda.
What age is the missus?
I'm 30 years old.
What's your job, missus?
My job is privately work, doctor.
Why, ma'am, is there anything I can tell you with?
Look, doctor, since last night I called, do not sleep, and went back and forth to the bedroom to defecate.
Oh yes, missus. Here, ma'am, I'll check first.
Yes, doctor.
This is normal mother's blood pressure, but your stomach is like bloating, ma'am.
Yes, doctor. My stomach hurts, so cannot sleep.
Yes, mom's sleep was disturbed due to diarrhea.
What is the cause of diarrhea, doctor?
The cause could be wrong food, ma'am.
Oh, yes, doctor. Yesterday, I finished eating food bought by the roadside.
So from there it is clear that the cause, ma'am, the food that you eat is not healthy, so it ails you diarrhea.
But this morning, I already took the doctor's continuous stop medicines. How come it's not healed? Yes.
Yes, mom, Because you have the wrong food, so there is a special medicine.
So, what's the solution, doctor, so that I'm gets better soon?
I'll just give you a prescription. Mom, you can read a menu ad at the nearest pharmacy.
Yes, doctor, thank you.
Yes, ma'am. Hopefully you get well soon.
Assessment. Date of assessment. October 15, 2020. Hours 8 a.m. A. Patient identity. The patient name is Miss H. Gender female. Age 30 years old. Education high school education. Status married. Address Karangmendo. Religion Islam. Occupation private work. Medical diagnosis diare. Who is in charge? Name Mr. D. Occupation private work. Religion Islam. Address Karangmendo. With patient. Relation with patient is husband. B. Medical history. 1. Main complaints. The main complaints of abdominal pain, limb, nausea, and vomiting, fever, headache, feeling thirsty, defecation frequency, sick time since overnight, with liquid consistency, yellow and slimy. Current disease history. The patient came to the hospital, Dr. Haryoto, with the main complaints of abdominal pain, limb, nausea, and vomiting, fever, headache, feeling thirsty, and defecation frequency six times since overnight, with liquid consistency, yellow and slimy. History of disease first. Patient said the had typhus in December 2018 and were treated at Dr. Subandi for 4 days. Family disease history. Patients say in the family no one suffers from infection disease such as tuberculosis, hepatitis, and declining disease such as hypertension, diabetes mellitus, and etc. C. Physical examination. Common condition: limb, nausea, and vomiting, fever, headache, feeling thirsty, and diarrhea. Awareness compass mentis, vital sign, pulse, 80x means, blood pressure 120 and 90 mm Hg, temperature 38 degrees Celsius, respiration 21x minutes. Presentation from our group may be useful. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.